Welcome to Dina Mina show as a part of Digital Health Days. And Mina and I are very happy to welcome here Anders Weilandt, a CEO of one of the leading Swedish digital health companies, buzzing in international media. And we had the pleasure to meet Anders half a year ago for Digital Health Days interview as well, and now we would like to follow up.
So we discussed diabetes tools as one of the most interesting applications in the digital health world, but you had difficulties with the implementation or the adoption of the tool, especially by the hospitals. Has anything changed since then?
Yeah, slowly and gradually, as we are doing installations now, and we have a little bit of a uptick here of this. That is good, but we met half a year ago, and fundamentally there isn't a lot of change, you know. So we still have a lot of hurdles to get over to get this to become a real reality. But it's certainly moving forward. It is. Yeah.
But we also saw on the news that Diabetes Tools as a company joined Continue Health Alliance. Did this have any impact?
Not yet, I would say. It will, definitely. I mean, like all sort of industries in its infancy, there is a certain lack of standardization and behavioral rule to guide you, because the development of the build-up of the industry is usually so fast in the beginning. Continua is certainly a great contributor to this, and it will become increasingly important as we go forward, because we need to have an organized environment in terms of the technology aspects and specifications for protocols and so forth. So we have great hopes for that to develop very soon. We really need it.
Great. So you joined this community of standardized and interoperable software solutions. Great.
Yes.
Yeah. You recently also acquired Diabetes Guru, which is a child app.
Yeah.
How are you planning to integrate this with the current platform?
It's a very good fit to us, as Diabetes Guru is a standalone app outside of healthcare connection, and we have a great need of being able to service patients, and this is child diabetes as well, by the way, that are not yet connected to a healthcare provider that actually carries our products. So this is to arrange a service for those that are still outside, and that will be the case for quite some time, of course. And then maybe it's not a good fit. Maybe patients would like to have their own application and work in their own way without really involving healthcare, and then that application will be the answer to that.
And lastly, last question for you would be, as for CEO of the company that has done so much in this new space, you've done clinical studies, you acquired tools, you entered Continue Health Alliance. What topics would you like to be discussed at the conference like this next year? What should be highlighted as a next?
I think we need to get more down to actions, talks, to really discuss hurdles, to put responsible authorities and decision makers in the hot seat, and really discuss the matters that has so far held us back. But there are several in all kind of areas, in legislation, data security, data storage modalities, patient ownership of data, and openness of the technical environment, and all those things. Conformity on the European level, all those things needs really to start to have a center position in the discussion. And I think a venue like this would be optimal for doing that, and that can be developed.
Great. We'll take this input with us for the next year. Thank you so much. Thank you for great presentation on the main stage.
Thank you for having me here.
And good luck for the next year from us.
Thank you.
Yeah.
Thank you.
Thank you.
Thank you.